然后你把你往上拖，就不是就那啥，自己往上拖一点你的胸部，往上拖一点。好了，可以。背面，呼吸。So did you notice that for female patient there's a lot of breast tissue? So what I did, asked Miss Wang to lift her tissue up, so I don't have to like one hand holding her breast tissue while the other hand I'm doing exam. So patient can actually help you out. Okay, the next thing I'm gonna do is egophony. So I'm actually gonna do put my hands again on the back of the patient or the front of the patient. I'm gonna ask the patient to say E, and then this is what to also see consolidations. If there's any fluid accumulation, it will the fluid will will transmit through the fluid, or consolidation. It will change, and it will change the sound. You will hear, instead of E, you'll hear A. So let's see. So 我现在还是把手放在这儿，然后instead of pulling hands this time, we're gonna use stethoscope. 你说一一一一一一一一一。So Miss Wang doesn't have any consolidation or fluid accumulation. I hear E pretty clearly. So the last part is percuss. So percuss including like percuss over all over the lung field. So you should hear resonance because lung is filled with air. And the next thing I'm gonna do is percuss for diaphragmic excursion. So what I'm gonna ask Miss Wang to do is to breathe in, hold, and then breathe out, so I can see how much the diaphragm will lower, and diaphragm will expand. What I mean by lowering the diaphragm, so I can see how much measurement that is. Okay. 我先要瞧一下。So far, it's pretty good. I hear resonance. I'm starting to hear the change from resonance to dull. That's because you start hitting the organs from here and down. So that's when you stop. So now I'm gonna start with the diaphragmatic excursion. kind of right around here. 吸进去，然后那啥，别放出来。So right here. So about like 4 to 5 centimeters. That's the diaphragmatic excursion of Miss Wang. Thank you very much. And the next part I'm gonna do is abdominal examination. So for abdominal examination, I'm gonna ask her to lay down. So the first part is I'm gonna check patient if there's any discomfort. Apparently she doesn't have any discomfort. For abdominal area, if people do come in with stomach discomfort, they normally will put their hands like guarding position. So then the next thing I'm going to ask her to do is to cough. Okay, so she did that, and apparently I don't see any pain expressions on her face or any body language. I don't. So it means like she doesn't have any hernia, peritoneal inflammation. So just superficially examining that. And then we're gonna do more examination later on. I'm looking at her face, her eyes for any jaundice. Also, I'm gonna examine her stomach for any discoloration, any scars, any swelling. She doesn't have any discoloration, scars, or swelling, so that's good. And the next thing I'm gonna auscultate. So I'm gonna auscultate full bowel sound. So she has normal bowel sound. If you do see a hyper bowel sound, people like the patient may have diarrhea. So you ask them like what they eat yesterday, is that normal for them? So you can find out a lot of underlying problems the patient have. The next thing, well, if patient have like hypo bowel sound, that means they're more constipated, or or there's any tumor occluding the bowel. So that can tell you a lot of underlying disease and problems as well. So the next thing I'm gonna do is palpation. So first is light palpate and then deep palpate. First palpate, light palpate will be palpating for mass. If you feel any mass, you don't want to do any deep palpation to dislodge the mass, the tumor. And then the deep palpate will be palpating for organs. And the next palpation will be the liver, spleen, and kidney, aorta, and spleen as well. Okay, so let's start the light palpate first. Okay, so there's no apparent mass or anything like that. So I'm gonna start deep palpating for organs. So I can feel Miss Wang's liver right here. The spleen, sometimes like you can't really feel the spleen. In her case, I don't feel the spleen. So I'm gonna try to feel for the kidney. The kidney is one of the hard to feel as well. So I can't really feel her kidney in this case. On her left side, I do feel the kidney a little. So what I did is I'm trying to like cushion her back with the hand, with my right hand, and then try to like deep palpate with the left hand for kidneys, because kidney is more deeper rather than superficial. So the next I'm gonna palpate for the aorta. The aorta, it should be around the the midline area. So what you do is you're gonna put like 2 fingers here at the umbilicus, around the umbilicus on both sides. Try to feel for any blood flow. I do feel a little bit. So the next I'm gonna do is to do a few examinations. The first one will be Blumberg's sign. That's also called rebound tenderness. That's testing for peritoneal inflammation. So as I actually did before, you just pretty much like deep palpating. You push down and then let go really quickly to see patient have any like feel any pain expressions. If they do, then that's positive for Blumberg's sign. And the next will be psoas sign. Psoas sign, what I do is to ask the patient to lift her left leg, right leg. So this test, as you can see, the right side, it's appendices. So what I'm assessing is for appendicitis. So let's do that. 抬左腿，就直抬。Okay, so 可以了。Miss Wang didn't complaining out any pain. There's no facial expression, no body language as well. So apparently it's just negative for appendicitis. Another sign will be obturator sign. That's also testing the same thing for appendicitis. She's negative for psoas sign, so I'm not going to continue doing that. But basically for obturator sign, you internally rotate the right leg of the patient. If they're positive for the sign, for obturator sign, they will express pain. The last test I want to do is the Murphy sign. What I'm gonna do is I'm gonna like deep scoop my hands very deep into patient's her right upper quadrant, right underneath the costal bone. So that I'm trying to push down and then let it go really quickly to see if there's any inflammation down there. In that area, it's pretty much the liver and the gallbladder. So we are assessing for cholecystitis or liver infections. So let's do that. So I'm palpating for the ridge of the bone, and then I'm gonna scoop down really hard, and I'll let go. This one didn't express any pain, so she's negative for Murphy's sign as well. The very last part is to percuss for liver and kidney span. So let's do that. I'm gonna start percussing from here. So that's the top part of the liver. So pretty much her liver, it's about like 7 or 8 centimeters. Okay, we're gonna do the same thing for the spleen. Start from here. For spleen, you can't really feel the part of the spleen that exposed out, like, you know, because spleen is more hiding underneath the bone, so you can really just feel a little bit of the spleen. But generally, for a healthy person, spleen should be around 11 centimeters. Okay, that concludes our examination. Miss Wang is pretty well, and there's no positive signs for any of the tests that we have done today, and she's pretty healthy. So thank you very much, and I'll see you in week 5.